Hi friends, welcome to the channel The Nurse. Here we are discussing about another part of NVS Female Staff Nurse Exam practice questions. In this video, I have included 25 questions. In that 25 questions, I have included nursing part, general awareness questions, general English questions, general Hindi questions, and last reasoning and aptitude questions. So we will go to the video. Before that, if you are not subscribed to our channel, please subscribe. Don't forget it. And if you want more practice test means you can download our Android application, The Nurse Academy from Android Play Store, and you can purchase the course. And I have uploaded around 99 tests. In that 120 questions in each test I have added, and you can practice it. We will go to our topic, that is NVS nursing exam questions, including nursing, aptitude, general English, Hindi, reasoning questions. Hi Vijaya, just a minute. Meha, Vijaya, good evening. We'll start now. First question, it is from nursing. First 10 questions are from nursing. The most common side effects of intrauterine devices. The most common side effects of intrauterine devices. Expulsion, pain, pelvic inflammatory diseases, increased vaginal bleeding. Hi Lokesh. First question, the most common side effects of intrauterine device. Expulsion, pain, pelvic inflammatory disease, increased vaginal bleeding. Those who are in online, please try to answer, then only we can make this session active. So first correct answer is increased vaginal bleeding. The most common side effects of intrauterine devices is increased vaginal bleeding. Next question also easy question. The common causative agent for cerebral malaria is. The common causative agent for cerebral malaria is Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. The common causative agent for cerebral malaria. Correct answer is option A, that is Plasmodium falciparum. Plasmodium falciparum causes cerebral malaria. Third question, the method of cleaning the rapid sand filter is. The method of cleaning the rapid sand filter is filter cleaning, filter control, backwashing, flocculation. The method of cleaning rapid sand filter. I am repeating, rapid sand filter. Correct answer is option C, backwashing. Backwashing in the means first the water will filter from normal sand filter. Then again it is another filtration layer will be there. In between one sand layer will be there. But the sand filtration is taking place. The water is coming downside. Then it is going up. In between there will be filtration by the sand layer. So that is why it is known as backwashing. It is a bit difficult to understand. You can take a picture or something with picture only. It is easy to explain actually. It is simple. Backwashing is used in cleaning of rapid sand filter. So that much you understand. No need to go deeper for that one. Fourth question. The major signs included in the surveillance of AIDS include the following except. The major signs included in the surveillance of AIDS include the following except chronic diarrhea for more than 1 month, weight loss of more than or equal to 10% of body weight, prolonged fever more than 1 month, persistent cough more than 1 month. Which one is not a major sign of AIDS given here? Please try to answer. The correct answer is option D. Persistent cough more than 1 month. That is a sign of persistent cough for more than 1 month means that is a sign of persistent cough for more than 1 month means sign of Prachi Gupta. That is the sign of TB, tuberculosis. All other symptoms are major signs of AIDS except option D, that is persistent cough for more than 1 month. That is a sign of tuberculosis. Fifth question. In usual situation, MTP Act allows termination of pregnancy. In usual situation, MTP Act allows termination of pregnancy at any time up to 20 weeks, up to 24 weeks, up to 28 weeks. In usual situation, the MTP, Medical Termination of Pregnancy Act allows termination of pregnancy. Correct answer here, up to 20 weeks. Up to 20 weeks in normal condition, the termination can be allowed. But in some exception cases are there. In the case of sexual abuse or rape are there means in the court can allow the medical termination of pregnancy up to 28 weeks. But normally up to 20 weeks only. But in exceptional case like sexual abuse or child abuse or rape, in that cases the court can allow up to 20 weeks. By checking the physical condition of the patient lady, the court can allow maximum up to 28 weeks in exceptional case, but in the normal case 20 weeks only. Sixth question. Conducting medical camp for a pap smear screening for carcinoma cervix is an example of. Conducting a medical camp for a pap smear screening for carcinoma cervix is an example of primary prevention, secondary prevention, tertiary prevention. It is not a preventive strategy. A small hint is here. You need to think before answer. It is a confusing question. You need to correctly understand what is pap smear and what it will diagnose. I know most of the people make incorrect answer. That is why I told think before answer. It is a confusing question. Okay, I will tell you the answer. It is a secondary prevention. Conducting medical camp for pap smear screening for carcinoma cervix is an example of secondary prevention. So can you tell what is the reason for secondary prevention? Why it is not under primary prevention? Prachi Gupta, can you explain it a little bit more? She has given answer early diagnosis. That is correct only. I will tell you the reason. Primary prevention means it is usually used to prevent the infection or prevent the disease. Secondary prevention means early detection. The disease condition is already happened, but early detection and treatment. So here pap smear will detect the cancer in early stage because it is already developed in a initial stage. Primary prevention means it should not develop. We will prevent the developing of the disease. That is coming under primary prevention. Secondary prevention means early detection and treatment. So here pap smear will detect early the cervical cancer. That is why it is comes under secondary prevention. Tertiary prevention, we all know, the tertiary prevention is used to prevent the going to more complication. That is what tertiary prevention. So pap smear in carcinoma cervix comes under secondary prevention. Seventh question. Observational study where the population is studied at one point in a time is. Observational study where the population is studied at one point in time is. Cross-sectional study, longitudinal study, case control study, cohort study. In this question, the thing is, the key word is at one point. The observational study is taking place at one point. The question is from nursing research subject. The correct answer here, that is cross-sectional study. Cross-sectional study. Why it is called cross-sectional study means the cross-sectional study is taking place at one point time. So as for an example, if COVID is happening at this moment, how much cases are happening and how much exposure is happening, that and all in single point in today, how much is happening, that is that kind of study is taking place in cross-sectional study. Same time, longitudinal study is just opposite to the cross-sectional study. In longitudinal study means it will take the same amount of population today, tomorrow, day after tomorrow, like different time it will take. So that is the longitudinal study and cross-sectional study. In cross-sectional study, at one point of time, what is happening, that only will study in cross-sectional study. Longitudinal study means the population will take different period. So today, tomorrow, day after tomorrow, like, or this week, next week, later, like that, will go in longitudinal study. Same time, cohort study means, whereas the cohort study is concerned with frequency of disease in exposed and non-exposed individuals. Cohort study means the frequency of disease in exposed and non-exposed individuals. Same time, case control study is concerned with the frequency and amount of exposure in subjects with the specific disease and people without disease. Case control study, it is concerned with the frequency and amount of exposure. Frequency and amount of exposure in subjects with a specific disease or specific cases and people without disease. That is what case control study. Next, eighth question. An example of food and waterborne disease is. An example of food and waterborne disease is diphtheria, hepatitis A, hepatitis B, hepatitis C. It is an easy question. An example of food and waterborne disease. Food and waterborne disease. Okay, I will tell you the answer here. Answer is easy question. It is an easy question only. The correct answer is hepatitis A. Hepatitis A it is a fecal-oral route transmission, and it is usually transmitted through the contaminated food and water. And what about diphtheria? Diphtheria is transmitted through mainly airborne or droplet infection. Hepatitis B and hepatitis C is bloodborne infections. The transmission through blood only. Diphtheria, airborne or droplet infection. Hepatitis A, food and waterborne infection, or transmission is through fecal-oral route. Next question. Modified risk factor for hypertension. Which one of the option is not a modifiable risk factor for hypertension? Sorry, which one of the option is example of modifiable risk factor for hypertension? Age, sex, ethnicity, obesity. Modifiable risk factor means the risk factor can be changed by altering some causing factor. So modifiable risk factor for hypertension, that means some cause we can some risk factor we can change and alter, and we can reduce the risk of hypertension. So in these options, only modifiable option risk factor, that is obesity. Obesity we can control by controlling food or doing regular exercise and taking healthy foods. These and all measures, intervention we can do to reduce obesity. So that way we can modify that obesity risk factor for the hypertension. But in the case of age we cannot change, or sex we cannot change, and ethnicity means that for an example, you are from Gujarat, or you are from Delhi, or you are from another country, American, African. So that is what ethnicity means. That also we cannot change. Only modifiable risk factor given here, that is obesity. And some other examples means high cholesterol foods and non-exercise lifestyle. These and all includes under modifiable risk factor. And non-modifiable risk factor examples are includes age, sex, ethnicity, etc. are comes under non-modifiable risk factor. 10th question. Swollen bleeding gums are due to the deficiency of. Swollen bleeding gums are due to the deficiency of vitamin C, vitamin K, vitamin A, vitamin E. Swollen bleeding gums are due to the deficiency of. This is also easy question. Correct answer, vitamin C. So vitamin C deficiency leads to which condition? Vitamin C deficiency leads to which condition? Yes, correct. Vitamin C leads to scurvy. And what about vitamin K deficiency? Vitamin K deficiency leads to? Vitamin K deficiency leads to? Vitamin K deficiency leads to bleeding disorders. And what about vitamin A deficiency? Vitamin A deficiency leads to? Vitamin A deficiency leads to? Vitamin A deficiency leads to? Yeah, correct. Prachi Gupta, night blindness. And what about vitamin E deficiency? Vitamin E deficiency leads to? Vitamin E deficiency. Usually vitamin E deficiency, very less chance only. Vitamin E deficiency will lead to neurological disorder, sometimes ataxia, skin disorder, this and all caused by vitamin E deficiency, but it is very less chance only occur in humans. Fertility issues also will happen while vitamin E deficiency. So next question from general awareness question. In that, first question is, from where did Gandhiji start Dandi Yatra? From where did Gandhiji start Dandi Yatra? Allahabad, Ahmedabad, Dandi, Calcutta. From where did Gandhiji start Dandi Yatra? Allahabad, Ahmedabad, Dandi, Calcutta. Yeah, correct answer. That is option B. Most of you given correct answer. Keep it up. Next question. What is the origin of Brahmaputra river? What is the origin of Brahmaputra river? Milam, Gangotri, Yamunotri, Kimayan Doom. Origin of Brahmaputra river. A small clue is there. That origin is from Tibet. The origin glacier located in Tibet. The origin of Brahmaputra river, that is from Kimayan Doom, that is located in Tibet. Kimayan Doom glacier is there. From there Brahmaputra originated. 13th question. Which is the highest mountain peak of Uttarakhand? Which is the highest mountain peak of Uttarakhand? Badrinath, Kedarnath, Kamet, Nanda Devi. Which is the highest mountain peak of Uttarakhand? Badrinath, Kedarnath, Kamet, Nanda Devi. Correct answer is option D, Nanda Devi. Nanda Devi is the highest mountain peak of the Uttarakhand. 14th question. When is the National Science Day is celebrated? When is the National Science Day is celebrated? 14th question. When is the National Science Day is celebrated? National Science Day. I think you know the answer. That is February 28. National Science Day, February 28. Next question, that is coming from a general English question. I do my work dash carefully to make mistakes. I do my work dash carefully to make mistakes. 15th question. Correct answer is I do my work too carefully to make mistake. I do my work too carefully to make mistakes. 16th question, that is from general Hindi topic. अमृत का पर्यायवाची शब्द है. अमृत का पर्यायवाची शब्द है विष, सुधा, मधुष, मधु, आम्र. अमृत, अमृत का पर्यायवाची, अदर नेम ऑफ अमृत. Vish, Sudha, Madhub, Amr. Correct answer is option B, that is Sudha. Amrit ka paryayavaji Sudha. 17th question, that is also from General Hindi. पृथ्वी का पर्यायवाची शब्द है. पृथ्वी का पर्यायवाची शब्द है रत्नगर्भ, हिरण्यगर्भ, वसुमती, स्वर्णमयी. पृथ्वी का पर्यायवाची शब्द है रत्नगर्भ, हिरण्यगर्भ, वसुमती, स्वर्णमयी. Correct answer is Ratnagarbha. पृथ्वी का पर्यायवाची, that is Ratnagarbha. Another this question also from General Hindi. हिंदी का आदि जननी है. हिंदी की आदि जननी है संस्कृत, पाली, प्राकृत, अपभ्रंश. हिंदी का आदि जननी है, हिंदी की आदि जननी है संस्कृत, पाली, प्राकृत, अपभ्रंश. करेक्ट आंसर इज संस्कृत. हिंदी की आदि जननी है संस्कृत. नेक्स्ट क्वेश्चन, that is from general English question. You need to find one word for the underlined words. The cashier wiped the nose of his employer by presenting false bills. The cashier wiped the nose of his employer by presenting false bills. So you need to find out one word for this term. Wiped the nose of. Options: doomed, abused, cheated, slapped. You need to find one word replacement for wiped the nose of. 19th question. Correct answer is option C, that is cheated. The cashier cheated his employer by presenting false bills. The other name of wiped the nose of, that is cheated. That is a phrasal verb. Next question also, you need to find out one word for this phrasal verb. The captain played with determination because the honor of the team was at stake. You need to find out one word for at stake. The captain played with determination because the honor of the team was at stake. Options: at the top, appropriate, very low, in danger. Rafat Ara Deeps Daily, Daisy a Daisy, Balram Rathod, Woong Sing Fee, Jaya Krishna Saundarya Sambat, Meha SD, Deeps Daily, etc. are given. Correct answer, that is option D. Option D is the correct answer. At stake means in danger. The captain played with determination because the honor of the team was in danger. At stake, the replacement is in danger. 21st question also, one word replacement for this phrasal verb, fast and loose. I will read the sentence. An honest person never plays fast and loose with his friends. An honest person never plays fast and loose with his friends. So you need to find a replacement word for fast and loose. The phrasal verb fast and loose. Options: delay tactics, to be inconsistent, deceives, ignores. 21st question. You need to find out the one word or replacement for fast and loose phrasal verb. A honest person never plays fast and loose with his friends. While giving answer, you just replace the option and read the sentence. When it becomes correct or not, just check. So here correct answer is to be inconsistent. A honest person never plays to be inconsistent with his friends. A honest person never plays to be inconsistent instead of fast and loose. That is a phrasal verb. Next question. This is coming from a reasoning question. 22nd question, that is coming from reasoning question. If you have pen, then you write. There is three reasoning questions are there. First is insect equal to disease. So the same manner war is equal to. Insect is equal to disease. The same way war is equal to. Army, defeat, arsenal, destruction. Insect equal to disease. The same way war is equal to correct answer is destruction, because insect invades disease. The same way war invades destruction. After war, there will be total destruction only. 23rd question. Book equal to cover. The same way painting equal to. Book equal to cover. The same way painting equal to. 23rd question. Book is equal to cover. The same way painting is equal to. Example: wall, color, frame. Think before answering. This is a reasoning question. It will be indirect question only always. Think before answering, because the options are confusing type. So think before answering. Correct answer is option D, because cover is used to protect book. Cover is used to protect book. The same way, which one of the option is used to protect painting? That is frame. Frame used to protect the painting. The cover is used to protect book. In the same way, the frame is used to protect painting. Next question. You need to choose the odd word out. Okay, the options are curd, butter, oil, cheese. 24th question. You need to find out the odd word out. I know it is an easy question. And can you explain it why it is you people choose oil? So all of you given correct answer only option C. Why it is you choose C option? Why C is right answer? Yes, Rafat Ara given correct answer. Rafat Ara, Pavani, Daisy, Wung Sing Fee, etc. given correct answer. All except oil are made by milk products. Milk products only. oil is not made by milk. So that is why oil is odd word here. So today's last question. This also I have given easy only, but you cannot expect this kind of easy question in exam. But this is an example only. You need to try this kind of questions more. Then only you can score high mark in exams. I am showing an example only. You need to try this kind of questions. There are so many questions available in online and all. So you need to try this kind of questions more. Then only you will be familiar with this question, and you can answer easily, and you can save the time also. So 25th question, what will come at the place of question mark? The number series includes 1, 9, 25th, 49. This question mark number you need to find out 129. The series starting from 1, 9, 25, 49, question mark. This part you need to fill. Last number is 121. Options 100, 91, 64, 81. This question is easy actually. And those who are giving option, kindly give a small explanation also. Then others also will get to know how to find out the answer easily. Those who are giving answer, kindly explain why you selected that option. Yes, correct. Adi Kavi explained 3, 5, 7, 9, 11 series. Yes, I will explain. The numbers are squares of the odd numbers. The number series are squares of the odd number. 1 is the square of 1 itself. 1 square equal to 1 only. Then next odd number is 3. 3 square equal to 9. Then next odd number, that is 5. 5 square equal to 25. Then that way next number is 7. 7 square equal to 49. Then it is coming after 7, the next odd number is 9. 9 square equal to, that is answer. 9 square equal to 81. So in the question mark place we need to fill 81. Then next number is, next after 9, next odd number is 11. So 11 square is 121. The relation between the number series, that is square of the odd numbers. 1 square, 3 square, 5 square, 7 square, 9 square, 11 square. So like that this number series is made. So this question mark is 9 square, that is 81. So that is about today's video. I think you enjoyed that video. If you have any doubt, means you can comment, and otherwise you please share with your friends, and don't forget to give a like for this video. If you are liked really this video, means please give a like. So thank you, and I know it is a late night, and you have joined with me during the late night also. Bye bye and good night. See you with another video. Bye bye.